Hi, this is Dr. Kronowitz and welcome to What's Hot in Plastic Surgery. On this segment, I will discuss reconstruction of the breast after lumpectomy. This has become a very important area in breast reconstruction and has often been neglected throughout the years. The reason I became so involved in this area of reconstruction is patients for many years would come to me after undergoing a lumpectomy and radiation with severe deformities of the breast, and my options for repairing these breasts were very limited and usually involved extensive surgery, which many of the patients were just not interested in. So let's talk about where we are now what are our options in order to handle the repair of lumpectomy defects. Well, it really depends when a patient comes. Ideally, the breast surgeon will refer the patient for a reconstruction of the lumpectomy defect prior to the lumpectomy even happening. And the lumpectomy repair or the reconstruction of the breast happens at the same time as the lumpectomy before the radiation, which results in the most natural outcomes and really is the best way to approach lumpectomy. So there are many approaches that I've actually participated in developing in many of the procedures on how we go about it. It depends on the size of the breast, where the breast tumor, and ultimately where the defect will be located, on how I approach these. I will use approaches that I use for doing breast lifts or doing breast reductions and rearranging the breast and putting tissue from one area into the area of where the hole that developed after the lumpectomy was repaired. When all is said and done, all you will see on your breast is essentially incisions that look like you had a breast reduction or a breast lift, and this is performed on both breasts. After the radiation is performed, sometimes little touch-ups or nip and tucks need to be done, or we'll inject some stem cells into the radiated breast to try to soften the radiation effects and to try to decrease the potential of the scarring of the radiation to come back over time. There are a lot of different approaches. I've continued to evolve and make it more specific depending on breast types, which has resulted really in outstanding outcomes. So if you're going to have a lumpectomy, have your breast surgeon give me a call so we can arrange and we can plan this prior to any surgery taking place. Now let's talk about another category of patients who already underwent a lumpectomy, had radiation, and now have a deformity in the breast. Over the last several years, I've developed a new approach to the way I handle these deformities. You really don't want to do extensive surgery on a radiated breast because they tend not to heal very well, and I've published many papers on this area. What I do is I use a large needle and I, through the skin, will release all the scar within the radiated breast. Then we'll liposuction fat from you, which is fat graft, and then I will filter it and I will re-inject the stem cells and blood vessels and other tissues that will lead to increasing the volume and in order to improve the quality of the radiated breast skin and to try to prevent the scar that I just released from reforming. And over time, after several sessions, I can improve your nipple position, I can improve the contour of the breast often becomes softened. Depending on the other breast, often at the initial procedure, I'll do a lift on the other breast and then we take it from there. Patients have seen excellent results with this, have been very satisfied, and it's really a very minimally invasive procedure with a quick in and out type of surgery. So just to summarize, patients who undergo lumpectomy have excellent options these days. This is called Oncoplastic surgery or Oncoplastic reconstruction. The important thing is if you're planning to undergo a lumpectomy is to make sure that your breast surgeon gets a plastic surgeon involved in order to perform the repair or the reconstruction of that breast at the same time or at least before the radiation occurs, so that these simple approaches using the remaining breast tissue can be utilized in order to reconstruct your breast. This is truly the best way and avoids the needs for these extensive, huge operations using flaps or the transfer of tissues from other areas of your body, which are really best saved or best used for patients who undergo a mastectomy. Thank you very much, and I really appreciate you tuning into this segment of What's Hot in Plastic Surgery. Thank you.